Physical activity can actually help you live longer. It's true. Everybody can enjoy the health benefits of physical activity. Dr. Brent Wallis, our friend Dr. B from People's Health, joins us today to talk about the importance of staying active. How you doing, Dr. B?
Hey, Tommy, I'm doing good. It's feeling nicer out there today.
It is a good day to maybe get out and take a walk or something like that. Is it true that physical activity can help you live longer?
Yeah, it definitely can, and a lot of research has actually shown that. Really staying active, what it does is it actually eliminates some of those risk factors that can actually lead to the major issues that lead to death, things like heart disease and stroke, because those are really caused by inactivity and in particular obesity. So physical activity is really about supporting your overall, general health, and regular activity really helps you prevent, developing conditions like diabetes and high blood pressure and high cholesterol, and it helps you maintain that weight.
It's hard sometimes to get in a car and drive to the health club, not that you have to go to a health club to get exercise, but I know on the way back I feel a lot better. Why is that?
Yeah, that is very true, too. Usually when you work out and you have a, real good active session, it actually allows your brain to produce something called endorphins. And when those endorphins are released, it actually makes you feel better. It gives you a little bit more energy. It's really one of the reasons why we tell people that it's a good idea, if you can get up early in the morning, to exercise before you start your day, because it can really kind of set the pace for what your day is going to be and make you feel better. It also actually can reduce your chance of developing depression or anxiety, because endorphins can actually give you that sense of well-being. And then the other thing you may have noticed is that after a day where you've been real active, you sleep better, and that actually is directly attributed to the endorphins as well, because they usually help you get a better night's sleep.
There's nothing like being physically exhausted. That nervous exhaustion mentally doesn't help you sleep at all. That physical exhaustion, absolutely. But how much activity is recommended? How do you know how much is too much?
Yeah, it really, it depends on your age. Children are really going to need a lot more moderate to vigorous activity. But for most of us, including our seniors, we usually say about 150 minutes a week of moderate intensity, moderate intense activity. And that can be pretty easily done with just 30 minutes a day. So break it up 30 minutes, 5 days a week. You can usually take 2 days off to rest. And keep in mind that the activity can be something relatively simple. It can be walking, biking, dancing, anything that you really enjoy doing. And you want to tailor the activities to what you're capable of and your fitness level. I do always tell people, speak to your physician about what their recommendations are, because you do want to be careful about overdoing it. And then the other thing that's good is to kind of mix it up a little bit, because that helps you, not get bored with the activities that you're doing. You want to do some strength training, but you also want to do some aerobic exercises as well. So you can do weightlifting. That can be something really simple. I tell people one of the easiest things to do is just take your laundry detergent and fill it up with water, and it's got a little handle on it, and you can lift those up, and that's a really good weight that you can use to build a little muscle strength.
And I was watching the super heavyweights yesterday. You don't have to lift weights where that steel bar is bending like rubber. You don't have to go that far, but why is it important to focus on that physical activity and the strengthening?
Yeah, the strengthening in particular is really important, because as you get older, your bones lose density, and that's why older people sometimes break their bones when they fall. So it's really important to do those strength-building exercises, because that really slows the progression of bone density loss. It really, if you can maintain your muscle mass and actually even strengthen a little bit as you age, it also really lowers your risk for falling. And everybody knows there's all kinds of complications that come from falling. But another area that it really helps in is with people that have arthritis or joint pain. Exercise can kind of lubricate your joints a little bit and make you feel a lot better. So it's going to really help you do a lot of your normal activities of daily living.
So what are some tips for some safe physical activity?
Yeah, there's a lot of things to keep in mind. One of the biggest ones I tell people is know when you've done too much, know when to slow down or stop. So when you're performing activities, you should really be able to carry a conversation. So if you're walking around, the block with a friend, you should be able to talk to them during that. If you feel super short of breath, then you're probably overdoing it. So you should slow down, maybe rest a little bit. And then, in the hot summers in New Orleans, drink plenty of water. You've got to stay well hydrated. And even today, when it's nicer out and a little less humid, it's still going to be pretty hot. So you're going to sweat and you're going to lose a lot of that water. So hydrate with water. And then make sure that if you decide to do electrolyte drinks, things like Gatorade or Powerade, talk to your doctor about that first, because they do have a whole lot of salt in them. So certain conditions can be affected by all of those extra salts. And then make sure that you warm up and cool down. It's important to, if you're going to do these intense movements and stuff, make sure you warm up your muscles, stretch a little bit so that you don't injure yourself. And then one other thing I tell people that are, kind of doing things outside of their home, especially our older population, is make sure you carry identification with you. If something does happen, if you do overdo it, you want to make sure that somebody knows who you are and maybe what your medical conditions are. If you've got a medic alert bracelet, that can actually help as well.
All right, we'll take a break. We come back, we'll talk about some things that you can do, maybe incorporate into your routine that'll get you started. And then a big problem is sticking with it. We can talk about that too. I tend to have a bad habit, doctor, of it's always got to be bigger, faster, stronger, right? And then you get to where it's like, okay, well, I'm up to an hour on the stair machine now, and then when it's time to do it, you think, I'm not going to go on a stair machine for an hour. That's crazy. And you get yourself in a rut where you wind up not doing it at all. Dr. B, our guest, Dr. Brent Wallis, our friend, People's Health, talking about the importance of staying active today. More when we come back. Right now, time for WWL Traffic. 8:25, Tommy Tucker back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, as we talk about not just senior health, really, but about the importance of physical activity. Somebody texted in, Doc, it's a good question about breathing in and breathing out. At what point do you inhale? At what point do you exhale?
Yeah, so breathing's always important while you're exercising. So really what the general rule for it is to breathe out while your muscles are working, so while you're flexing, and then to breathe in when you're relaxing. And one thing to keep in mind, too, holding your breath actually can increase your blood pressure. So for our patients that have elevated blood pressure, you don't want to hold your breath for too long. That can actually cause problems.
All right, what are some things that people can incorporate into their everyday routines and actually accomplish two things? You're getting some exercise, you're getting something done.
Yeah, there's actually a whole host of things you can do. And one thing I'll mention, some health plans like People's Health, for example, have fitness benefits. So that can actually give you a free gym membership. You don't have to go to a gym, though. There's plenty of things that you can do around the house, especially during the summertime. It's harder to get outside and get some exercise. So household chores can actually be plenty vigorous enough to give you, that fitness that you need. So mopping and vacuuming, actually going up and down your stairs can be very vigorous activities, so that can help. What I tell people is actually, people sit around and watch TV for too long, and if you really enjoy watching your shows and stuff, that's fine, but get up and move around while you're doing it. You can actually do sit-ups, you can walk in place, you can walk around your coffee table. That'll get you a little bit of the exercise you need. And then when it's nicer out, like today or when the fall comes around, hopefully in October, getting outside and walking around your neighborhood, walking your dog, going to visit friends and stuff, that's gonna really help your fitness routine. And keep in mind, one thing that physical activity really does help with is building a healthy immune system. So with everything that's been going on the past year and a half, it's important to have those defenses available. So, exercise routines are going to help that as well.
And some tips for sticking with it, because I said it before the break, and it's true. I keep adding on. It's like 30 minutes, and 35, then 40, then 45. Then I get to the point where it takes so long I don't do it at all. And that's not the way it should be at all, and it's not necessary, is it?
No, not at all. And that's why we tell people break up that activity. So 30 minutes, 5 days a week is really not that hard to do. I mean, think about how often we spend 30 minutes doing relatively nothing, maybe looking at our phones or watching TV. So really what you do need to do, though, is create a plan and try to stick to it. And sometimes a way you can stick to it is tell your family about it, tell them what you're doing so you can get them to support you and encourage you on it. Another thing you can do is really track your progress. So, pull out an old paper calendar, put it on the wall. You can, check off each day that you did your activity or write the activities you did and the amount of time you spent on it. Some people that use their phones all the time may want to do it on your phone. There's a lot of apps that can actually track your progress and even show you calories burned and everything. And then what's really important, because it does get boring, if every day you're just walking around the same block and everything, you want to mix up your routine so that you don't get bored. You want to do different exercises on different days, and that actually can keep you a little bit more interested in it. And then, one thing that you mentioned too, Tommy, you can always come up with excuses. There's always something comes up that's going to prevent you from exercising, and you go a day or two like that, and suddenly your routine's all blown. So really try to anticipate anything that could prevent you from exercising so you can keep with it.
I found it's best to start with baby steps. It's like, you know what? You don't have to do anything, but by God, you're going to get on that treadmill. You can just stand there if you want, but you got to get on it. And then from that point, once you stand on it, it's like, well, yeah, I'm going to walk. I'm on a treadmill. Thank you, Doctor. I appreciate your time as always.
Thanks, Tommy. You have a great weekend.
Have a good day. You too, sir. And if you want to find out more about People's Health, very easy. You can go to peopleshealth.com/radio. You can call 1-866-687-7335. And you can always follow People's Health on Facebook, Twitter, and Instagram. 8:30, time for WWL First News. And for that, we go to Dave Cohen.